Now moving along into our next study, which is PADMA study, looking at the current role of CDK4/6 inhibitor plus endocrine therapy. Is it the right approach, rather, which is the standard of care? But again, when compared to chemotherapy in aggressive disease, is it an appropriate approach? We have seen similar data with Right Choice, which did establish that, yes, CDK4/6 inhibitor plus AI is the right approach. Jame, what was the study design for PADMA and what did it show?
Right. This is an interesting study. As you said, it's adding to the existing knowledge and strengthening our conviction that endocrine treatment with CDK4/6 is the right treatment, even in first-line metastatic with, if I can say, high risk. Right. So the study design is it's about 150 patients randomized between endocrine treatment plus palbociclib, and the control arm is chemotherapy of physician's choice. These are hormone receptor-positive patients, HER2 negative, indication for mono-chemotherapy, no prior treatment in the metastatic disease, no asymptomatic but only oligometastatic. These are not like low-risk patients. So the patient should not have uncontrolled or untreated CNS and life expectancy more than 6 months. So let's just say if I'm seeing a 42-year-old with multiple liver lesions, asymptomatic, LFTs are normal, and a lot of time I get this phone call from the second opinion or offering doctor saying, hey, she's young and she has multiple lesions in the liver. I feel like I should be giving chemo. But I say, look at the biopsy. The ERPR is strongly positive, HER2 negative. I always say, let's try endocrine treatment, of course, now with CDK4/6, the right choice. And then this PADMA data reinforces our strong belief that's the right thing to do. The primary endpoint was time to treatment failure. The secondary endpoint is progression-free survival and overall survival. And they had a majority of the patients were postmenopausal. And the really interesting finding is nearly 50% had liver mets. So median time to treatment failure is 17 months in the Palbo endocrine arm and 6 months in the control arm. Progression-free survival is 18 months versus 9 months. So that's a pretty significant difference between these two arms.
Yeah, again, CDK4/6 inhibitors with endocrine therapy is still our standard of care. This is practice reinforcing study. In all comers, be it someone with visceral disease, heavy tumor burden, CDK4/6 inhibitors with endocrine therapy should still be our go-to.